Health is the most important value. Especially now, scientists and researchers around Europe have been looking for ideas how to transform healthcare. In EIT Health, we believe that innovations can enable breakthrough performance. But how can we build bridges and develop healthcare innovation together? EIT Health is the largest community of healthcare innovators backed by the European Union. We work across borders with leaders, scientists, medical doctors, authorities, market regulators and patients. This energetic community works to improve diagnostics, treatment of patients and well-being of citizens. However, there are still EU regions where innovators might need a bit more support. EIT Health InnoStars, the regional innovation cluster of EIT Health, is there to help. We focus on Hungary, Italy, Poland and Portugal, as well as regions in Central, Eastern and Southern Europe, where the overall pace of innovation is moderate. Thankfully, there are no borders for the progress. Through various programs, we support sustainable development of early-stage ideas and innovation projects. It's like with traveling. Innovators journey with different equipment. The proper toolkit is essential to succeed. We scout for the best teams, but then we provide them with education, acceleration, funding and networking. Only last year in CEE and Southern regions, we trained over 1,000 students, medical doctors and clinicians. We accelerated over 50 startups and hundreds of innovators who work now in an international environment on clinical validations, new products or scaling up. We are here to press the appropriate button and help talents hit the ground running. You can co-create the healthcare of the future with us. We invite go-getting innovators, universities, companies, startups and institutions. With EIT Health, innovation can flourish no matter where the ideas come from. And we are sure, together we can shape the healthy future.
Welcome to everyone who joined us on LinkedIn and Facebook today. My name is Tamás Békesi and I'm a Business Creation Manager for Central, Eastern and Southern regions of EIT Health InnoStars. And this is Rise to the Challenge event, episode 2. Every Thursday at 2 p.m. Central Eastern European time until 11th of March, we will host startup leaders who will hopefully share some secret ingredients of their successful journeys and give you some tips how to skyrocket. Feel free, please, to ask questions, comment and invite your networks. Why do we do that? So what's the aim of this event? Because the new wave of EIT Health acceleration programs is open and we would like to get in touch with you, help you to choose the right program and support you in your development. EIT Health is funded by the European Union and its most powerful network of healthcare innovators and investors. If you are a go-getting innovator interested in health, we are a good place to moor your boat. So let's start. Our today's guest is David Breitenbach, CEO of co-founder of SINEKO Global, who participated in InnoStars Awards 2019 and EIT Health Head Start 2020. Hello, David. Thank you for joining us today.
Hey, everyone. Thank you for the invitation.
David, let's start with a light question. Tell us more about your story, how all these things happened and how it all started.
Okay. So actually, it all started with one of our co-founders, Bence, and his background, what you have to know about him is in medicine and computer science. And the story begins with him having some beers with his friends in a pub in Budapest, where his friends who are radiologists were telling him about their work, about their daily work. And it turned out that they were a bit complaining and sharing stories about how difficult it is to work in radiology as a radiologist, because 40 to 60% of their daily work time is spent with creating reports, radiological reports. And they actually asked Bence if he can figure something out to help them in their work. And then Bence obviously created this multilateral team with computer scientists, radiologists, and me from the business side. And then we joined some accelerators, and the journey began somewhere there.
Sometimes, citizens have the feeling that innovation is something which is a kind of abstract term, so they cannot really touch it, they cannot really meet day by day. So let's talk about a little bit of your product. So what is the product? How can you help medical professions and citizens at the end of the day, of course?
Yes. So the product is basically called Grade. And this is a structured reporting software specifically designed to help the work of radiologists. So in current terms, radiologists are creating unstructured report, which means that they are typing in usually the reports by themselves or with an administrator, and then they hand out the reports to the patients or who requested the report. But unfortunately, since this report only is from unstructured text, this cannot be reused, this cannot be further used for research, and it takes a lot of time to make these, and it's very redundant. It's hundreds of times a day, the same sentences mostly. So what we are doing with Grade is basically structuring the report creation process for radiologists. So we have created questionnaires, dictation, and also a graph-based approach where the users and radiologists can easily find any lesion on the human body by only clicking on the anomalies on the human body and then just giving it properties. And while doing this, a report is automatically generated on the software, and this report consists of structured data. So the output is a structured report, which we can translate to other languages since we have programmed for Hungarian, German, and English grammar rules. This can be used for further research as well as publications in medicine or optimizing the hospital efficiency and operations. And of course, this can be used to help the work of radiologists to make the work a bit faster and easier.
And how it goes to the final, let's say, delivery quality from the patient's point of view. So what will they feel? Of course, they will not use your software directly, but what is the impact they can feel in their everyday life?
Yes. So one, usually there are some problems with these reports, especially if it's an unstructured and typed in report. So the first thing that patients can see that the efficiency of the report creation and the quality of the reports will be better. So there will be less mistakes in the report. And the second thing is that since this is structured data and it can be translated to other languages, we are not only translating it from one language to another, which is basically just professional medical language to another professional medical language, but we can translate one report on the same language to layman's terms. And basically, everyone can understand what the report consists of. Probably, I don't know if you've been in a situation where you got your report and you wondered, what does it mean? Yes,
it's
so
not
basically
something for us, of course. Yes.
Yeah. Yes. So basically, people like me, whose background is in business, can understand the report Grade creates from now on.
That's cool. That sounds really cool. And of course, we are now living, almost 1.5 years, we are now living in a special era of the globe. And we hear a lot about the importance of AI in the fight against COVID-19. How COVID-19, because of course, we do hear a lot about the damages, the disadvantages of COVID-19. How did you feel about this period? Did it bring you, advantages or disadvantages or a mix of it? So how are your business impacted by COVID-19?
Yeah, so basically, I would like to speak about two perspectives of COVID regarding our startup SINEKO. So the first is from the demand side. So from the demand side, I think COVID only had positive impacts on us, since when identifying COVID patients and helping them recover, it really relies on radiological imaging. And since there are, or the number of COVID patients has exponentially grew, then the more and more radiological images needed to be reported. So actually, COVID brought us a lot of demand. And after like the second wave or the higher number of cases has appeared in hospitals in Switzerland or in Hungary, many hospitals has approached us, and also we have been approaching some hospitals too, and they are using now our service. We are trying to perfect our service and adjust our features to their needs. So that's from the demand side. But from the organizational side, actually, it didn't really have an effect on us, I guess, because since we are a startup, we have always had this very flexible work culture, and obviously our work is not as much organized like a big corporate. We have been working remotely most of the times before COVID happened, as well as after COVID. So, in terms of the organizational perspective, I don't think anything has changed. But from the demand perspective and the business perspective, I think it was a very positive change. Yes.
That's cool. Okay, and just for our audience, let me remind you that you can ask questions, leave comments, and share your thoughts with us. We will answer as many of them as possible, so you can also take a look at our acceleration programs at eithealth.eu and InnoStars.eithealth.eu, or just simply jump into our catalog, which will be hyperlinked in our comment section. So I would like to encourage you to look at our comment section, leave your question, or just jump into our catalog, because we have so much things to offer. And of course, in the second part of our discussion with David, we will also touch one of these programs. Actually, we have now 16 programs this year, so each and every maturity level of startups, we can offer you something. David, your EIT Health journey started in 2019 with the InnoStars Awards, and then you proceeded to Head Start in 2020. How did these programs help you in your journey?
Yes, so InnoStars Awards was a huge step for us, I believe. I think this was the stage, we were at the stage where we had to perfect our business plan, and we had to kind of learn how to operate in the field of medtech. So what we got here was basically basic training about the basic business functions. We got to know how to do our finances. We got to know how to do our basic marketing. We got to know how to speak with investors, how to raise funds, and how to perfect our product. So that was very, very useful. I have to tell you that. And then also InnoStars Awards, that was a journey that not only flew us to many countries. If I remember correctly, we went to Portugal and to Germany as well.
Yes, but the good old times, you know, when you can travel.
Yeah, the great times. Yes, but this was basically a competition among the startups, and not only could we compete with our ideas and compete with our learning pace with the other startups, we could also share ideas and inspire each other and get to know a lot of amazing people who are working to make the world and healthcare a better place. So this was definitely a point in our life, or in the life cycle of our startup, where we grew a lot and we learned a lot, and we made it to the finals, which was an amazing experience for all of us. So that was very, very, very useful for the startup. And then from there, we were very motivated, and we were on a very good success curve, I guess. So we joined Head Start, which is another EIT Health program that was organized in 2020. And the main goal at Head Start was to use the EIT funding. We got all in all 50,000 euros. And to use that 50,000 euros to improve our product, to get to the perfect market fit and to validate our product perfectly, and basically to develop and upgrade and to commercialize. That was very successful in this accelerator. We actually got to the finals as well, which we won with some other startups too. So that was a great journey. We loved that. We actually learned a lot about IP protection here. We also got a small grant here to secure some IP fund and to kind of appropriate value or try to appropriate our value proposition. And then at the end of our journey at Head Start, we got our first revenue. So I would have to say that the program reached its goal. We have been accelerated and we could kind of get to the commercialized phase.
And as far as I know, thank you for that. And as far as I know, that you are now planning to go to the next EIT Health program, which will be the EIT Health Catapult. And how this is aligned with your next steps? How is your strategy for the upcoming 1 year at least? And of course, how Catapult can help you? What is your vision on that?
Yes. So Catapult and Business Plan 2022 are the two EIT Health programs that this year we are aiming to go for. Since in the first 6 months of the year, it's more about the Business Plan 2022, we would like to go for Catapult from September. And this program mainly aims, as the name shows as well, to kind of put you on a catapult and to really accelerate your growth and help you in scaling. So the goal of Catapult is for us to start scaling and to get to as many hospitals as we can, to increase our commercialization effort, and to basically get to a stage where we can finance ourselves and or get an investment at the end.
Okay, that sounds good. And just for our audience, Business Plan 2022 is an opportunity, let's go this way, where you can team up with big enterprises, medical universities, form up a consortium, and go for big innovation projects. So it's out of accelerator in our portfolio, but it definitely, so we are striving to push more and more startups into consortiums and give them the opportunity to work with big players. Thank you, David. And just to remind you that you can ask still questions on the comment section, so please feel free to do that. And for those of you who have joined now, let me share with you that the conversation we are now in will be available on our Facebook and LinkedIn pages after the live event and can be followed later on. Please share your questions, as I just mentioned you. And if we are out of time, of course, we will get back to you and answer for your questions. But of course, we will try to answer as many questions as possible during our session. And just as one of the final questions to you, David, so what would you advise for the new generation of innovators who maybe just had an idea or maybe already have some tangible prototypes or MVPs in their hands? What will be the next step?
Yeah. So for us, I think the most challenging part of our journey, especially the initial part of our journey, was to find the right product market fit. And I think most of the startuppers have an idea, a great idea in their minds, maybe a great MVP, but what they are missing or what I can recommend them to do is to go to the customer, speak to them, show them what you have, ask the right questions, try to get as many feedback as you can. And if you are having a product which can be improved with the lean approach, then of course, adjust your requirements, adjust your design, and test your product, test your MVPs as many times as you can. I think this is the advice that we got in the very early stage, and this is the advice that we benefited from the most. I think the most difficult part in a startup's journey is when you have your MVP and kind of getting to the product market fit and getting customers which love your product.
Thank you for that. And I can absolutely agree with you. And yes, how you just mentioned at the beginning, let's share one more thought with our audience. So how you mentioned regarding InnoStars Awards. So go out, show your product, meet people. Of course, now it's a little bit different, or we cannot say it's more difficult because in an online world, you can meet almost everybody in minutes. So that shouldn't be a barrier. So even though we are living in a different times, you can do it. So for fresh innovators, that's probably the most valuable insight. And thank you for that, David. Let me share some questions with you. So let's start with a question from Jack. So hello, David. I have my own startup on medical device, and I would like to ask you, how did you manage how do you manage the equity exchange for funds?
Yeah, that's a very interesting topic, and I think our startup has a very different approach, unorthodox approach to this. So what you have to know about us, that we have had around 5 or 6 offers, investment offers, and we got term sheets as well. But in the end, we declined all of them, and we are rather working for free or for less money for something, for our mission that we dreamed of, than getting an investor or a VC firm behind us who doesn't really share the thoughts or basically the approach that we would like to go with. So what I can recommend to you, you have to just kind of, as in a marriage, you have to find the right fit with investors. What I can really recommend is look around, try to find friends or try to find potential partners in your potential network that would like to work with you or that are seeking for investment opportunities. That would be much easier to talk to them and to get them to the same page and to the same idea. And if it comes to VC firms or bigger players on the investment market, I think the basic approach is that before going and speaking with them, you have to try to increase the value of your company as much as you can. And how can you increase the value of your company as much as you can? Basically getting traction. That's the most important part. And I think that's the biggest element in the equation for investors. So you have to go to customers, speak with them. You have to do pilots, as many pilots as you can. You have to get customers. If you have revenue, then basically your startup's value doubles, triples, or it increases exponentially. So if you want to keep most of the company or the shares or the equity, then I would suggest to go with this. But on the other hand, I have to share, as one of my professors at the university always told me, you have to always ask yourself, do you want to be king or rich? And this is the question you have to answer for yourself. Do you want to sell a higher share for a potential greater profit with a great fit of investor? Or do you want to keep your shares with a possibly lower share of the market? So I think this is something everyone has to decide. But I would like to ask you to go and speak with investors, to go and seek what they are looking for, what is their portfolio like, how can you increase the value of your company, and then maybe if you find the right fit with them, you can figure something out from there.
Thank you, David. We have time for one more question. This is from Jose Antonio. Hi, David. I'm currently working in pharma industry, but thinking about setting up my own business. Any useful tips you can share how to start and where to find proper support?
Okay. So I think most of the people who we met at the EIT InnoStars Awards or Head Start, they were in a very similar situation before they came into the program. A lot of startups were in pharma industry, or they were researchers in a hospital, or they were working in healthcare in some sort of way. And what they did, they were actually looking at niches or problems in their own jobs that they could kind of solve. So when you look at your own job, just think about what is the best way to make my job more effective, or what are the biggest problems that I can identify and I can solve with my own company or with my own assets and skills. And when you realize that you found a problem, you have to ask the people around you if they observe that problem as well. And then when you got to a stage that everyone sees the same problem and everyone's definition of the problem is the same as yours is, then basically you already have a lot of partners who can help you find support. So from there, basically, you can start your startup journey. But other than that, there are certain networking events that you can join. I think EIT Health has a lot of opportunities as well to find support. So I can really recommend to start your journey. Ask EIT Health what kind of programs they have, what kind of networking events they have. Share your ideas there, and then maybe you will find support there if you cannot find in your immediate among your immediate friends or close relatives. Yeah.
Thank you, David. And even though we are almost run out of time, there we have so much good questions and feedbacks. I would like to give time for one more question, actually a dual question. And besides that, David, I would like to ask you, whenever the session is done, please check out the comment section, because there are actually some offers for cooperation with universities as well. So that can be something you can talk with the relevant person from the comment section. So sorry, who I cannot really read out as an offer, but David will get back to you, and you can talk about the details. So the final, let's say, dual questions. The first question, this is from Petruta. 2 questions. Do you have any tips and tricks that we can follow for InnoStars application? That's a pretty good question, I believe. That's correct for now. And what are the key roles you think any startup should have from the beginning?
Okay, these are great questions. So tips or tricks that you can follow for the InnoStars application. I think the most important is to try to use the grandma or the baby rule with the InnoStars application. I don't know if you guys are familiar with that. It's basically when you are pitching your idea or when you are writing something down, then you have to learn how to write down your ideas in a way that even a baby or even a grandma can understand it. It has to be very short, very straightforward, and very easy to digest. So if you are writing your application, just try to write it first, give it to someone who hasn't even heard about your company before, who doesn't know what you are doing. Let him or her read it through, and then just basically answer the questions and try to think with other people's mind. So you have to be very straightforward, and you have to be very concrete about the ideas and the plans that you have. I can also recommend to think for basically a bit far, think long term as well. Think what you can kind of reach, or what value you can bring, not only to yourself or in terms of finances to your company, but to the society as a whole. So it's very important in EIT Health that you create something that can help other people grow.
David, can you hear me?
Yes. Am I back?
I believe we have some technical issues. Yeah, David, now we got back David. So David,
Okay,
you were
I'm sorry.
frozen.
I don't.
No worries. Come on. This is the beauty of
Sorry.
technical issues are just coming and going. So that's
Yes.
absolutely okay. Thank you for that.
So what I was saying about you have to think long term about your idea as well, and try to come up with solutions that create social as well as financial values as well. So what I was saying that in EIT Health, it's important that you create solution that helps people as well as the sector. So for the first question, yeah, that's the two basically on a very high level. That's the two advices I could give. And for the second question, what are the key roles you think a startup should have from the beginning? I think the most important here is to think about what you need as a core function in your startup. So by that, I mean, if you are a software company, then obviously you will need a software developer, someone for the business, and someone who organizes work or leads the company. But on the other hand, if you are doing something which is very, very much related to research and creating basically a whole new device, then you need someone who is responsible for the design, for the marketing, and for the like basically to create that device from procurement to supply. And what I can really recommend everyone that when you are first in your startup, I have seen Apple's journey as they grew, and what they did basically, it's a good case. If you have some time, just read it through. So what they did, they had people for the core functions, and they had someone who was called the everything else guy. And I think it's something that every startup should have an everything else guy, because since the work is not organized as much as in the case of corporates, you have to have someone who is responsible for the things that you haven't assigned any responsibilities to. So yeah, in a nutshell, that's my advice.
Yes, and just one more thing, actually, just related to what you just said, is that in many cases, what is our experience in case of healthcare startups, that of course business side is not too, close to them. So because usual researchers, medical students, or medical workers are not really having a strong connection with business. But from the really beginning, I don't know, you agree with me, but you need at least some friends or some co-workers around you who can help out on the business side, because unfortunately after a while you need money just to survive, not because to become rich in 1 year, but just to make your projects sustainable and survive. I don't know, what's your experience and view on that, David?
I 100% agree with you. I think these are all very different worlds. And just coming back to Petruta's question, when you create your team, your initial team, I think it's very important that you try to come up with a multilateral team, meaning that the people in your team, they are from different fields, and they are using a different approach to solving problems, or using a different thinking method or skill. So in our case, it was software development, medical sector, and business. This was the three main areas that we created our business from. And we have our arguments and we have our differences in terms of thinking, but gadflies are always useful, and it's always useful to have a fruitful argument that leads to a better solution. So I think it's something that every startup should think about, how they can get some people that maybe can approach this problem from another perspective. It's perfectly enough if they just tell you guys their thinking or their thoughts or what they like about it, what they don't like about your solution. And then from there, you can ask as many people as you want. The point is that the more people contribute from different perspectives, the better product you will get in the end.
Absolutely agree. Thank you, David. Thank you so much for being with us today. And dear audience, thank you for joining us, and stay tuned, because next week my colleague Ines will meet with Alessandro Monterosso from Patch AI, a startup from Italy which developed the first empathic virtual assistant for patients who are enrolled in clinical trials. Don't forget to check our website, check our catalog, or go to innostarted.eithealth.eu and supply with the comments and questions you want to raise it. Sooner the better to apply to our programs as well. So if you find anything reliable and relevant for you, please come and apply. And in the meantime, if you need any advice, you can freely contact our team. And of course, follow our channels. See you soon. See you next week.